Hello, I'm John Schlitt, the president of the School-Based Health Alliance, and I'd like to welcome you to this presentation, A Culture of Health and Data. Where do school-based health centers fit, and where are data efforts going? In just a second, I'm going to introduce you to Haley Lofink-Love, the Director of Research and Evaluation at the Alliance, who's going to describe for you our initiative called the School Health Services National Quality Initiative. But before I do, I want to start with this. In God we trust, all others bring data. Now, I use this quote, which I initially attributed to Linda Usjak, our former president, who used it quite a bit, to set the stage for what is an era of accountability for school-based health centers. There was a day where we were required to provide little data about the services that we were providing, to say nothing of the outcomes that we were delivering. But that day just doesn't exist anymore. Today we're seeing increasing competition for healthcare resources, and every one of us in this sector must demonstrate the value that we bring to it, the outcomes that we can deliver to both the education and the health and education sectors. I had attributed this quote to Linda Usjak, our former president, who used it quite a bit. I, in fact, learned that it was Edward Deming, the father of quality assurance in manufacturing, that had initially coined the phrase. As I did some research about Deming, I learned he had quite a bit of sense of humor. He also coined this phrase: "It is not necessary to change. Survival is not mandatory, after all." And while I say this with tongue-in-cheek, I know that school-based health centers across the country understand that we do want to survive, and that for us, change will be necessary. And welcome. And here to make that easy for you and to explain it all and how we're going to create a national quality data set that will reflect our work and the strength of the school-based health center model is Haley Lofink-Love. Haley, take it away.
Thank you, John. So this afternoon I'm going to talk about a culture of health and why does it matter to us. The Robert Wood Johnson Foundation, a prestigious national foundation, recently redefined its priorities to support efforts that aim to transform the way communities approach complex challenges. They're supporting work where people are working across sectors to create what they call a culture of health. In your health centers, you witness children and adolescents who are exposed to stressors that lead to disparities in health and education outcomes. These are the kids that you see every day. They arrive at school carrying burdens such as hunger, food insecurity, chronic stress, and homelessness. These lead to poor attendance and dropout, and depression, substance use, and obesity. When you think of the culture of health in which they live, it's a tough one. They constantly swim against a stream of pressures. But there are places where communities are moving out of their silos and working together to create a culture of health. And school-based health centers are a great example of it. School-based health centers are catalysts, helping make schools places that prioritize health and wellness. The Robert Wood Johnson Foundation selected 40 factors that define a culture of health, factors in communities that they believe influence positive change, and SBHCs were selected as one of those indicators. Out of everything that they could have picked, their shortlist included hundreds of indicators. They picked us, and they're interested in knowing the number of school-based health centers that provide primary care every year. SBHCs were selected because they're an exemplary model of cross-sector collaboration working to improve health and well-being for children. The CDC's Community Guide recently completed a systematic review of school-based health centers. They invested nearly 2 years in reviewing all of the data and evidence about school-based health centers. As a result, SBHCs were recommended by the Community Preventive Services Task Force. The review of the evidence shows that the presence and use of SBHCs were associated with improved educational and health-related outcomes. They also completed an economic evaluation of SBHCs and found that the economic benefits of SBHCs are significant as well. SBHCs contribute to reductions in emergency department use, reduce costs of asthma-associated emergency department use and hospitalization. They contribute to avoiding losses related to missed school time and missed work time for parents, and play a role in reducing unintended teen pregnancy. These findings underpin the decision of the Robert Wood Johnson Foundation in selecting school-based health centers as an indicator of a culture of health. In selecting school-based health centers as a measure, they're telling us that they want to see us grow and thrive. They want to support our data collection efforts so that we can tell even more compelling stories about SBHCs. Today I'm going to talk about the Alliance's current efforts that will help us tell that compelling story of SBHCs with data. Data that can amplify our powerful anecdotes. Data that conveys the hard work that you do every day. The comprehensive care that you provide that helps children lead better lives. I'll tell you about an opportunity that has the potential to improve care for children and adolescents and strengthen the sustainability of our field. This time last year, we introduced the School Health Services National Quality Initiative, an initiative we call the NQI. It's funded by the Maternal and Child Health Bureau and is a partnership with the University of Maryland Center for School Mental Health. The initiative is challenging the school health services field to voluntarily adopt and report the first ever set of standardized performance measures. So what does this initiative make possible for us? We believe that if school-based health centers can align priorities and voluntarily collect data in a standardized way, we'll be able to describe the quality of care being delivered in SBHCs at the national level, which is paramount to the sustainability of the model. As the healthcare landscape becomes increasingly competitive and based on value rather than volume, we need to be able to demonstrate the care being delivered. By reporting standardized data to the Alliance, SBHCs will be able to compare themselves at local, state, and national levels and assess their strengths and areas for improvement. And by investing time in assessing our data and identifying ways to improve practices, the quality of care that children receive will improve. As the saying goes, what gets measured gets done. Together with this initiative, we can improve care for children and adolescents. The Maternal and Child Health Bureau set an ambitious target for us. They want to see 50% of school-based health centers voluntarily adopting and reporting performance measures by 2018. So how can we work together to achieve this goal? Well, we've already started. We've been working together with members of the field since day one of this initiative, knowing that its success hinges on working together at every step. We didn't hide in a dark room and pick the measures. We needed you, the field, to tell us what we should be measuring, the measures that convey our value add to the healthcare system. So we invited people representing diverse stakeholder groups to help us. Alliance members, board members and staff, SBHC providers and administrators, representatives from state affiliate organizations and government offices that fund SBHCs, and educators and payers were part of the process. Ultimately, 90 individuals representing the field participated in the process, which took 6 arduous months to complete. We asked you to examine, discuss, and score potential measures that could capture the value add of our model. You told us what measures you think are the most important, sensitive, feasible to collect, and usable for quality improvement and advocacy. And we listened. After 3 rounds of scoring, 5 measures were selected. This was a huge feat and represents the first ever set of standardized performance measures for school-based health centers. You decided that the best way to demonstrate the value add of SBHCs to the healthcare system is to work to ensure that children and adolescents have an annual well child visit, risk assessment, and BMI screening. You also decided that adolescents should be screened for depression and chlamydia. We're thrilled with the measures you selected. They align with existing national child quality measurement frameworks such as HEDIS, CHIPRA, and Meaningful Use, allowing school-based health centers to compare themselves with one another and with other healthcare settings. Right now, the way school-based health centers report data looks a little bit like this. There's commonality, but with measurement, the devil is in the detail, and there's considerable variability in the definitions of the measures at state and local levels. This initiative allows us to be able to compare apples to apples and be aligned not only with one another, but also with national child quality measurement priorities. We are also thrilled with the measures you selected because they're diverse and allow us to capture aspects of physical health, for example, nutritional and reproductive health through BMI screening and chlamydia screening, as well as behavioral health through the risk assessment and depression screen. And the measures are both child and adolescent focused. We see these 5 measures as our starting point, and we anticipate that the measures may expand in the future as we grow in our understanding of the interaction between health and education. For example, by next year, our goal is to introduce a measure that allows you to document the amount of seat time saved when children can access care in an SBHC, ultimately helping reduce absenteeism and improve student achievement. These 5 measures are meant to be a manageable starting point and allow us to start aligning our priorities. Since last fall, a number of very brave school-based health center programs in 8 states joined a community of peers as innovators and early adopters of the 5 standardized performance measures. SBHC programs in Colorado, Connecticut, North Carolina, and Seattle-King County have been working together as a part of a learning collaborative focused on how to adopt and report the performance measures. Teams of SBHCs in New York, Ohio, California, and Minnesota have also been reporting the measures. We've learned a tremendous amount from the experiences of these pioneers, and we're translating the lessons learned into resources and promising practices that can be utilized by the field. If our participants in the Learning Collaborative were here right now to tell you about their experience, they would tell you that it's been challenging, but it's worth it. Teams of SBHC administrators, providers, IT support, and coordinators are getting together, examining the measures, and setting bold goals for improvement. They started looking at their data each month, and many of them initially said, wait a second here, there's something going on here. This data really doesn't reflect what I'm doing in my health center. When you look at data, amazing things can start to happen. When people start to see data, they start to ask questions. They become aware of areas for improvement, and behavior starts to change. Teams are overcoming challenges that they felt were insurmountable just a few months ago. They are adapting their electronic health records and figuring out how to get data in and out. We can't underscore enough how challenging this technology component can be. This has taken time for sites. Many started saying that they were unable to report the data that we were requesting, saying things such as, we don't document this, or we all just do it a bit differently, or we've never done this before. But now they can. The motivation to improve is awesome to observe. To improve well child visits, teams are pulling data from health information exchanges and building relationships with providers in the community. To improve practices around depression screening, they're standardizing practices so that all providers are measuring the same way. Providers are also thinking creatively about how to identify sexually active students, simply figuring out how to ask the right questions in order to provide appropriate preventive services. To put it simply, they are delivering better care because of this initiative. Today, we invite you to join this movement. Quality counts, and this is your opportunity to adopt the 5 performance measures. We've created a strategy for the upcoming year that will help us reach toward our goal of 50% adoption. We're taking a top-down and bottom-up approach to reach toward our goal of 50% adoption, and we're engaging stakeholders at every level in order to succeed. So let's start at the top. Over the next year, we'll work with many of the national, state, regional, and local partners to try and streamline how we collect data about school-based health centers. In states, regions, and in SBHC programs where reporting performance measurement data is a requirement of funding, if we can align our measures, we can leverage our resources towards shared goals. We already have buy-in from Connecticut, North Carolina, and Colorado who are working towards eventual statewide adoption. We're also going to work together to create a groundswell from the bottom up. For the SBHC administrators, providers, coordinators, and support staff here, we are inviting you to voluntarily adopt and report the measures. We know that this work can feel daunting, so we've tried to simplify it into a series of steps for the upcoming year, and we will provide you with resources to support you. So this is what we're asking you to do. This summer, we encourage you to form a team. Get all hands on deck. Engage your sponsor organization and get school-based health center staff, providers, coordinators, and support staff to buy in. If you have access to IT or EHR vendor support, get them on board as early as possible and ask them to help you set up your electronic health record to collect the appropriate information. What we learned in our 2013-14 census of school-based health centers is that 87% of school-based health centers report that they're using an electronic health record, showing that our field is utilizing technology in order to improve practices. Once you've established your team, we encourage you to carefully review the measures. It may be that you're already required to report similar data. However, your definitions may vary slightly, and you'll need to set up your system to collect the correct data. You'll also want to review the measures in order to make sure that everyone is on the same page and documenting the same information. This fall, when school starts, you'll kick off the collection of the 5 measures. This winter, you'll practice, practice, practice. This work takes practice. You'll make sure that all providers are entering data the same way and practice extracting data from your electronic health record. We'll invite you to share data with the Alliance in January 2017 and populate a free, customized report that will show how you compare to other health centers who have adopted the measures. The more you can practice extracting the data and examining it, the better. Next summer, you'll be invited to report the 5 measures at the end of the 2016-17 school year. So some of you may be asking, are they requesting personal or protected health information from us? The answer is no. Participants will only be asked to report aggregate de-identified health center client data. You will not provide any protected health information about health center clients, such as an individual's past, present, or future physical or mental health condition. Others of you may be wondering what supports the Alliance will offer you. We are pulling promising strategies from our Learning Collaborative participants and have translated them into resources for you. We've created a website where you'll find multiple supports to help you get started. If you go to our website, www.sbh4all.org, and go to the Resources tab, click on Quality Counts. Here you'll be taken to this page where you can review definitions, learn promising strategies, view tips to set up your EHR, learn what data is being collected and how privacy is protected, and join an online community of peers with whom you can exchange questions and promising strategies and challenges. This initiative will challenge the field to align its priorities, but the potential gains are enormous. It's an unprecedented opportunity to be able to tell our story in a more uniform way. This will allow us to tell a much stronger story. It will allow us to learn from school-based health centers that are doing particularly well, and it will help us identify ways we can improve. We'll be able to show everybody that school-based health centers are vital to a culture of health. These data will allow us to show what we already know. We'll be able to prove to others that the care is top-notch. These data will resonate with our national partners, and you'll be recognized for all of the hard work you're doing because a positive light will be shined on school-based health centers. Let's do this together. Let's continue to build a culture of health for children and adolescents and show the value of the SBHC motto, so that by 2018, our map of SBHCs voluntarily adopting and reporting the measures looks more like this. The payoff for the hard work will be worth it. We will be providing better care and helping the model to grow. We have an incredible team at the Alliance working on this initiative, and we want to thank everyone for the efforts they've invested and will continue to invest to make it strong and reach our goals. We also have a wonderful group of colleagues at the Center for School Mental Health who are collaborating with us on this initiative and doing similar work with comprehensive school mental health systems. I'm sure that many of you may have questions, and we encourage you to reach out to us at info@sbhforall.org, and we'll help you with your questions as you get started. Thank you.